Good evening, team. Heart attacks. Obviously, talking about this organ up here. So, we're going to be talking about myocardial infarctions, also called heart attacks. So, in this evening's lecture, we'll call it a lecture, really just medicine made easy. But we'll be going to be talking about what a heart attack is, signs and symptoms, what to expect at the hospital, and what kind of big bag of medications you're going to get when you come out again. So, stick around. So, what is a heart attack? If we look at this organ here, your big heart, which supplies blood and oxygen to the rest of the body, has to have its own oxygen and blood supply as well. So it has these little coronary arteries going through it, which supplies it with blood and oxygen. Over time, starting a lot earlier than you'd think, these arteries can get full of rubbish and plaques. We call it atherosclerosis, all fatty deposits, etc. So what happens when you're having a heart attack is part of this plaque will break off and we get a blood clot or a clot within the coronary artery, stopping the flow of blood to the heart and stopping the flow of oxygen to the heart and essentially starving part of that heart of oxygen. So what happens is it starts to die. So one of those coronary arteries is blocked and there's a heart attack going on. What signs and symptoms are we looking for? These are the signs and symptoms you're looking for. These are the ones that I've seen, but not limited to these. You can have central chest pain, central crushing chest pain, radiating up to the jaw. It can radiate down the left arm and it can go down the back. They could be feeling very short of breath and they're going to be having a general feeling of unease, anxiety, and feeling a little bit dizzy. Could also be very short of breath. There's also something called a sense of impending doom, which I have witnessed in real life a few times, and they really do have a sense of impending doom. They really are concerned and want to get to the hospital. So hopefully by now an ambulance has been called and the ambulance crew is on the way. The 999 call taker may have said to take an aspirin. An aspirin is an antiplatelet, so essentially it just makes the blood less sticky, so stops things sticking to each other to make your heart attack worse. When they arrive, they'll take some observations from you. They'll probably do an ECG on you, so that's where they put the sticky dots on the heart and it looks at the electrical conduction of the heart. They'll be able to tell if you're having a heart attack or what kind of heart attack at that point. If they see changes, they can send that straight off to the hospital. And if there's no changes on the ECG, it doesn't mean that you're not having a heart attack. You can have something called an NSTEMI. So what that basically means is they'll still treat you as a heart attack, they'll get you into the hospital, and they'll need to do some blood tests to see if there's anything else going on with the heart. But if they've seen the changes on the ECG, they'll give you a range of medications to make the blood in the heart less sticky, essentially. They'll give you something to help with the pain as well. They should whip you off to the hospital. You could go possibly straight into something called PPCI, primary percutaneous coronary intervention. So basically you go to something called the catheter lab, where you see the cardiologists, and what they're going to do is put a stent in the coronary arteries. In one of these arteries here, they're going to put a little tube in and hopefully open it back up again and get the blood flow going. So, your recovery. Unfortunately, I can't comment on this. I don't know how long it will take because it depends on the severity of the damage that's been done by the blockage in the heart. But you should probably come home with a big bag of medications to help with the recovery and prevent it happening again. These are some of the medications you might get. It's not limited to these. You might get different ones. You might not get them all. But you might come home with some antiplatelets initially. So they are to stop the blood being sticky, like I mentioned before. So that's an aspirin, or you might get a clopidogrel. You might get a beta blocker that helps regulate your heart rate and it helps lower the blood pressure as well by opening up those arteries. You might get an ACE inhibitor, so it's a type of blood pressure medication, something like a Ramipril possibly. It helps with heart failure and blood pressure. You'll probably be given some statins as well to help prevent this happening again, which helps with cholesterol, etc. And you might be given some nitrates, So that's like a GTN spray, or you might be given some nitrates in a tablet form as well. So essentially, that's heart attacks in a nutshell. Also called myocardial infarctions. You know, I'm trying to break down the medical term to the layman's term, not to be confused with a cardiac arrest. That's completely different. But anyway, thank you very much for watching, and please subscribe if you enjoyed it. And again, please do drop a post below if you do want me to talk about anything else. Cheers, team. Have a good evening.